you're recognized.
Thank you, Chairman. Mr. Connell, you just highlighted one of the limitations with health savings accounts by mentioning that they are primarily focused or used only in high deductible plans. You highlighted that that's an issue. Earlier this year, I introduced it's called the Hope Act, the Hope Act, the Health Out-of-Pocket Expense Hope Act, HR 955. What this bill does is, it's a critical step towards getting better healthcare access to more people. It would create flexible, tax-advantaged HOPE accounts that any insured American, regardless of income, could use for everyday medical costs, modernizing the way that they use these flexible spending accounts. And count on your support for this bill.
I'm encouraged.
You basically just endorsed it.
I'm encouraged by what I hear, but I know enough about tax and healthcare policy to know that I don't know until I look at the details.
And that's what I'm highlighting it for you, to sincerely look at this. And I hope we can move past this, like what I just heard too, like, oh, HSA accounts, used by millions of Americans to be able to choose how to get a tax advantage way, having the choice and the ability to lower their own costs and make it more affordable. And all I hear from my colleagues on the left is, oh, they throw parties with this stuff, or this is for retirement. I'm getting sick and tired of it. This has been a huge penetration of Americans that have said, this is a great way to help healthcare more affordable. And we have something right in front of us. It's a bipartisan, it's been introduced in this committee, and I'm hoping that it gets some traction so we can actually address the issues. Because what my colleagues have said, we just keep throwing money at a subsidy, it's never gonna make consumer choice drive a market to affordability. So I appreciate your willingness to take a look at this. Ms. Reichert, this committee's been fortunate to hear from CMS Director Dr. Oz several times, and we've been pleased with the work the CMS is doing on the rural health transformation program and its implementation. One of the things Dr. Oz has stressed is the importance of allowing pharmacists to practice at the top of their license or take a more expanded and active role in patient care, which they are educated and equipped to do. What opportunities and benefits do you see for pharmacists to take more active roles in chronic care management, testing, and treatment for Medicare beneficiaries?
Yes, thank you for this question. As we've said before, pharmacists are an underutilized healthcare resource. We have training and clinical abilities to reduce ER visits, hospitalization, and increase outcomes. So legislation like ECAPS helps to empower Medicare beneficiaries by providing coverage for testing and treatment by pharmacists. ECAPS help to preserve access for the patients who need it the most.
Awesome. Dr. Parikh, one of the silver linings, there may have been few, but one of the silver linings of the 2020 COVID era lockdown moment was the increased experimentation and implementation of telehealth. Many of the telehealth flexibilities put in place by Congress were on a temporary basis, and this committee has been working to extend several of them. What is the impact of telehealth options for patients with chronic conditions, especially in rural areas across state lines?
So anything that increases access to care will improve outcomes, and we need to give patients variety of avenues for the type of care they need. Telehealth absolutely has to be part of the armamentarium there. In terms of chronic conditions, we can think of it in several ways. One is people with chronic conditions still get acute issues, right? They still get a rash, they still get sinus infections. And for those things, if they don't have to miss a day of work, if they don't have to leave their child home alone, if they don't have to, they can't afford to get transportation in, it's a great way to treat them for their acute issues and also avoid that expensive ER visit, which may be the only other option for them. Second is chronic condition management. If you have a patient who has a chronic condition, you've seen them once, you've done the exam, a lot of times the follow-up visits to make sure that the plan is working, that they're improving, that you're on the right track can certainly be done by telemedicine. Again, it's convenience and sometimes saves the patient a lot of money. And then the third is avoiding a serious complication. You have a patient with heart failure, we talked about remote patient monitoring. If there's someone that you note that may be having signs that they're going into early worsening, you can have a telemedicine visit, adjust the medications, adjust the treatment plan, and again, avoid them ending up having to go to the emergency room or hospitalization.
Yeah, I think this would be catastrophic to miss on this opportunity, to have seen something work well and not take advantage of it just because of whatever difficulties we have, getting things extended and approved for future use. Telehealth should be something that we should all be able to rally behind, and goes to the larger issue of what has worked in the past. Let's make sure that we're doing that going forward, and what has had maybe a good intent but has not had the outcomes that we've wanted, and be able to scrap that and move in a better direction. With that, I yield back.